Thanks everyone for your patience this morning. Just wanted to make sure at least we gave some time for a few others to join the call, but certainly we can get started, and those that'll come along and join throughout the process will be great. For those that I haven't had the pleasure of, interacting with throughout, thanks very much for joining, and we'll get into it. I will start by acknowledge that today I'm on the lands of the Wurundjeri people of the Kulin Nation here in Naarm in Melbourne, and pay respects to their custodianship of this country and acknowledge their significance in this place, and certainly also acknowledge country where everyone else is located that's joining the webinar today. So taking a couple of quick steps back, this is the review that we've undertaken is the National Mental Health and Suicide Prevention Agreement. As many would know, it was signed in 2022. It sets out the shared intention of governments to work in partnership to improve the mental health of all Australians and reduce the rate of suicide to zero. All states and territories signed bilateral agreements with the Australian government to deliver local initiatives. The National Mental Health Commission published a progress report in 24 showing that most initiatives as part of the agreement are on track as at mid-2023. The current agreement is set to expire in June 2026. And so our process in terms of the review itself, we started in January 25, and we were commissioned by the Australian government to conduct the final review of this agreement, and the terms of reference that were provided to us from the Treasurer in relation to considering the wellbeing and productivity impacts of mental health and suicide prevention programs and services under the agreement, assessing the effectiveness of the administration of the agreement, including reporting and governance, and ensuring the voices of First Nations people and those with lived and living experience are heard as well. So in the engagement and consultations that we had prior to the interim report, we heard from people with lived and living experience, their families and carers, peer workers, service providers, practitioners, researchers, peak bodies, associations, primary health networks, hospitals, Mental Health Commission, and government departments in all states and territories. We had 54 online meetings, 5 days of in-person meetings in Canberra, Ipswich, Hobart and Launceston, 95 submissions that we received, and 283 responses to our online survey. And then engagement post the interim report, we've held public hearings. We heard from people and organisations representing people with lived and living experience, and families and carers, service providers, PHNs and academics. Our online meetings focused on areas of further research and seeking feedback on improvements in the next agreement. And so we held 21 online meetings. We had 3 days of online public hearings. We received 148 submissions, and we held 8 roundtables and briefings and presentations throughout that process as well. And I would like to thank everyone who's participated and contributed to the overall process for us, because it's been certainly worthwhile hearing the views of those involved in not only delivering services but also accessing services. Certainly has been, a welcoming exercise for us to understand some of those intricacies to consider as part of our overall process. And throughout our online survey, the online survey was the survey that was undertaken prior to the interim report. What we heard through that online survey is that there is service fragmentation and how this affects people who have to tell their story multiple times, difficulties people face in finding the right services for themselves or the people they care for. There are positive aspects of services and the commitment of individual practitioners. The key messages we heard from our engagement, that we heard there's been some progress being made against the agreement's commitments, but it's not supported the meaningful improvement for people with lived and living experience, their carers and families. There are significant opportunities to improve in the next agreement, and those things are about centering the voices of people with lived and living experience of mental health challenges and suicide and their carers and families, strengthening the governance and accountability, including setting measurable outcomes for reform, and ensuring the commitments in the agreement have a clear link to its objectives and roles and responsibilities and are well defined. In our visits, and these were the visits that were undertaken prior to the interim report, and we were doing the site visits across the country. We had the opportunity to see firsthand the work done in some of the Medicare mental health centres and other types of community services. We heard from people with lived experience and their carers about positive and negative experiences of services, and we saw many examples of excellence and best practice, but often policy settings were not aligned with the way services operate. In our hearings and submissions, we heard about the need to articulate a long-term direction for mental health and suicide prevention reform and improving monitoring and accountability. People with lived experience and their carers spoke about gaps in mental health and suicide prevention services and the lack of coordinated care. We also heard about the pressing need for governments to work together to tackle the social factors that affect mental health and suicidality. Our interim report included a number of information requests that we're still considering as part of the process, and these were some of the things that we focused on, asking specific questions through in the process post the interim report, and certainly through the public hearings, to make sure that we developed a better understanding of how to improve on those things that would go to informing our recommendations in the final report. And in those consultations, we heard diverse views on the need for a dedicated schedule to improve outcomes for people affected by co-occurrence of mental ill health and problematic use of alcohol and other drugs. Some of the submissions included examples of where people with lived and lived experience had a central role in governance and service delivery and the mechanisms that supported their contributions. And the review participants have raised the need for accessible reporting that helps consumers and carers make more informed choices and enables service providers to better plan services that respond to local need. So where are we at in the sense of, progress towards completing the review itself? Our final report will be handed to government in 4 weeks' time. As you can see in the time that we've got on the screen in front of you, we're due to back to government on the 17th of October. Once the Australian government receives the final report, they then have 25 parliamentary sitting days to determine when they will release it publicly. So we'll give it over on the 17th of October, and then government's got some time to work out when they're going to do their thing to make sure it gets out in the public domain. So it now takes us very quickly to our Q&A session. There is one question that's come through that I'm seeing at the moment, and the question is, does the release date of the final report also require a response to that report by government? And the answer is no, it doesn't. It doesn't require a response by government. But certainly, I guess given that we've been commissioned by government to undertake this process, you would certainly expect that there will be a response. And given the fact that it's something that involves all states and territories, there would be a conversation from health ministers in relation to what that response looks like as well. The other question that we've got that's just come through is, have we received any submissions or input following the interim report that will make you reconsider any of the recommendations in the interim report? That's a good question. And we certainly have received, and I think we mentioned it a little bit earlier, is where we've asked for further information from stakeholders and from those involved in delivery of services, particularly around the co-occurrence, because we certainly have received feedback from various groups in relation to the pros and cons. So whilst we're not able to give an indication of what the final recommendations look like, so there were varying views and varying degrees, I guess, of agreement or engagement with the conversation about things like looking at co-occurrence as a schedule as part of the final recommendations. Looks like we've got lots more questions on the recommendations. So what I will say is that, unfortunately, we aren't able to provide you with advice or information on the recommendations today. So if you've signed in to get some early insights on the recs themselves, I'm going to apologise and say sorry. That's not what we can do today. That's the final report that we'll provide back to government on the 17th of October for them to then consider and work out when they provide a response or release it publicly. But certainly what we can do is to give you an indication of where the process is at, what we've heard, where we've gone, and certainly what's been the activities that have occurred since the interim report release, leading into I guess the preparation of the final report to provide back to government in October. I've got a specific question in relation to some examples of programs or initiatives that effectively tackle the social factors that affect mental health and suicidality. What we did here, certainly through public hearings and other conversations, is the need to focus on those things that are broader than than just dealing with mental health issues or suicidality. And some of those examples that we did hear from not only the public hearings, but certainly through consultations, were dealing with things like housing. And that became, I guess, a common theme, that when we were focusing on what essentially was a holistic process or a holistic view to then consider how do we tackle or deal with some of these more complex problems, that it did require a much more, I guess, considered approach that focused on the whole of social determinants about how better to deal with things through improving housing and supporting those sorts of things that would then ultimately impact upon a person's experience of mental suicidality. Another question we've got that's come through is the final report, including some of the positive or successful initiatives, ways of working and learnings from the current government. There many of those things that we have heard, and certainly we've received submissions in relation to some positive examples of things working well, or where we do see some things working well. Those things, particularly where there are public submissions, those things will be made publicly available, and certainly will be part of I guess the what we heard report that we provide at the end as well. And so there will be an opportunity to consider those things as part of, I guess, the next phase, in the sense of where government then takes the recommendations and starts to then work out where they go next, that we do have a body of knowledge or information that then provides some advice back to government in respect of the things that are actually working well and getting some traction in community. One of the questions just come in, but some of the things that in the last round of consultations that's provided, the consultations are provided or surprised you. Certainly one thing that we did hear very, very clearly that came out in the public hearings, and these will be certainly publicly available for people to go and have a look at, is really the need to focus on information sharing and best practice and what that looked like. So that was a message that was loud and clear through public hearings. Certainly heard it through in pockets prior to the interim report, that there needed to be a greater focus through the agreement on research and innovation and then sharing of information, so that we're able to share practice across the country about how best to tackle some of the more complex problems. But there was a much stronger feeling that came out of the public hearings about the focus on research and innovation as well. The next one that's come through is about feedback in relation to the 12-month extension and the suicide prevention schedule. Certainly the 12-month extension, again, mixed views, because some saw the urgent need to consider to make sure at least we're focusing on those things continuing. In terms of the suicide prevention schedule, I think it certainly the overwhelming support in relation to a suicide prevention schedule, and that was backed by much of the work that was going on and the work that was happening in making sure that it built upon the existing work that the National Suicide Prevention Office had done with the sector in developing the strategy itself. So understanding, I guess, what we did hear much about in terms of the support for a schedule was it's a good idea, because it then builds upon the existing work that the Suicide Prevention Office has undertaken to develop, to work with the sector to ensure that there's a focus on specific things into the future. And as I mentioned, the 12-month extension, we did have, I guess, mixed views across the sector, purely based on some believing, yes, it was necessary to slow down, to think about that broader policy architecture that's required, but certainly some that were still thinking, no, we needed to make sure we continued the focus and sharpen it. Don't slow down, because if we're slowing down now, the traction that's already gained may be lost. So again, mixed views in relation to those sorts of things. Another question was around the key arguments in support of the mental health and AOD schedule, and were there different arguments for and against the AOD component. And certainly there were, we did hear many different, I guess, arguments and stories in relation to an AOD schedule, particularly in focusing on the co-occurring model. And that was something that came out in many of the conversations, and certainly something that we focused on in the public hearings, is getting a better understanding of what would be what would be the elements of an AOD schedule? If we're going down the path of recommending that, what would be the things that would sit in an AOD schedule naturally that couldn't sit inside the broader mental health and suicide prevention agreement? And as I mentioned, the focus of the conversations was then about understanding the issues of co-occurrence and what that looked like, to then make sure at least we can weigh up the pros and cons as to whether or not it did require certainly a specific schedule to focus on those sorts of things. And much of the key arguments in that were very much about, I guess, the high numbers of people who are requiring access to drug, alcohol and other drug services that do have co-occurrences themselves. So that was really where the key argument came out is what's the quantum of people? How do we quantify the amount of people who do require both? But understanding that there are some specific things that are needed in the AOD sector as well. Certainly, another question that's come up in the chat is feedback on the interim report, and certainly the interim report generally was pretty positive, and so most of the commentary that we got, and certainly in the conversations around the place, was very supportive of what we'd recommended in the interim report, and certainly from many people in the sector. I guess expressing our understanding of the sector, because when we described the sector as fragmented, we described it as something that did require some particular attention. Many people already believed that was the case. So I think it was that we'd hit the nail on the head through the interim report in describing the sector and the need to look at some further reforms in the sector. Another question that's come up is the interim report expected to consider implications to the mental health system coming from the Thriving Kids announcement and or other NDIS reforms? Certainly one thing that was in the interim report that we explicitly focused on and had conversations direct with the health ministers when we spoke to them about the interim report, is that there needed to be some particular attention focused on the 500,000 people who are missing out on who are no longer eligible for NDIS. And so that was something that we kept reiterating, that there needed to be some urgent attention to focus on those people who are missing out on those services. What that means in terms of the impact now with the reforms and certainly the changes through the creation of Thriving Kids, that's not something that we're across at this point, but certainly continuing to drive home the fact that there are 500,000 people that have been identified who are missing out on the NDIS, who do require support, and there needs to be a solution to support those people. We'll be considering the needs and experiences of particular groups, such as adolescents, their families, in the recommendations, or are they likely to be generic? The recommendations more broadly, because of the consideration themselves, whilst there was a focus on priority populations that sat in the previous agreement, so there was a number of population groups that sat in the previous agreement, certainly our conversations and our discussions to inform what the final recommendations might look like, were certainly in the spaces that we have continued to have the discussions. So certainly for us, understanding what is happening for Aboriginal and Torres Strait Islander people, and knowing that in the interim report we suggested a schedule that focused on the social emotional wellbeing of Aboriginal and Torres Strait Islander people. So it's understanding what are those specific pieces, but how do we actually influence the rest of the mental health and suicide prevention agreement to work better for all parties as well. Another question that's come through: many submissions have provided information and case studies to the Commission about lived experience governance. Yes, certainly we did hear about lived experience governance and where that was working well, not only through the case studies and the submissions that came through, but certainly in the public hearings we had groups that talked about the process that they'd undertaken in terms of developing governance arrangements to include lived and living experience in their processes, which actually informed, better outcomes and informed better ways of managing things, and certainly setting up new services in a way that involved lived experience from the beginning. So those things certainly came through as part of the process for us. Looks like we're getting more and more questions about the recommendations. And just to reiterate, what we can't do today is to provide you with the actual recommendations. What we can do is to give you an indication of what we've explored in terms of topics and questions and what's come out of the public hearings, because all of those things are informing what will go into our recommendations in our final report that we hand back to government. For those that missed a little bit earlier, the release date itself, what we provide back to government is 17th of October. The release date post that, government then the Australian Parliament has 25 parliamentary sitting days to then provide that to the public. But certainly from our perspective, in capturing, I guess, the stakeholder networks and groups that we have had through this process, we can sort of keep people informed to know when those things are actually occurring as well. If there aren't any more specific questions, as I said, we can't provide advice on the regs today, can provide advice on the process. Process for us now is that we're working towards handing our final report to the Australian government on the 17th of October. They then have 25 parliamentary sitting days to make that report public. Certainly what we can, if there aren't any questions about those things now, and said if there are other questions, happy to take them. But if you do have additional questions that you haven't been able to ask today, but you still think are unanswered, happy for you to not only put them in the chat, but certainly drop us an email to give us an indication what those things look like. But if there aren't any other burning questions today, we might pull up stumps there, but certainly thank everyone for coming along, for dialing in and showing your interest in this particular topic, in this inquiry. And certainly do appreciate your time and energy in all of those who've made submissions, all of those who we've spoken to, all of those who've participated in the public hearings. Really appreciate everything that you've done to contribute to the process for us, because it has been absolutely worthwhile. We hope that it's certainly something that is going to contribute to a more effective system in the report and recommendations that we hand back to government. And I do look forward to engaging with groups over the coming weeks and months, once the report becomes public, to then have some further discussions about how do we make sure at least we can get some traction to improve the system. So thank you very much for dialing in today, and I'll hope to talk to you all soon.